Hello my dear student, welcome to Medical Anatomy. Today we are going to discuss about clavicle. In this video, we are going to discuss about osteology related with these bones, myology, ossification and clinical anatomy related with these bones. Let us start. So when you will be holding these bones, maybe your exam may ask you, say its feature or peculiar features. So you see these bones in our body placed horizontally. And it is a modified long bone. Why it is modified long bone? Because shaft, if we cut, we will not see any medullary cavity inside. Another point is, it is modified because shaft of these bones will be developed from two primary ossification center. Another peculiar features related with these bones is, these bones in our body started to ossification at first and get its complete ossification at last. Another information related to its ossification is, though it is a long bones, maximum portions of these bones is ossified by intramembranous ossification, except its medial end, which is ossified by intracartilaginous ossification. Then this bones is inferiorly on the medial two-third pierced by a cutaneous nerve. Name of that is intermediate supraclavicular nerve. So now let us start discussion related with this bone's gross feature. So as it is horizontally laced in our body, it has two ends. As like typical long bones also containing two ends, it is also having two ends but horizontally placed, so it has a medial end and having a lateral end. Intervening this area, we are saying it is called shaft. Okay. Then these bones, when we are describing end wise, we can start description. Let us first start with the medial. The medial area, it is somehow rounded and total four surface. What are the four surface? Anterior, posterior, superior and inferior. On the other hand, the lateral end, it is flat above downwards. So it have superior surface, inferior surface, anterior border and posterior border. So lateral end have two surface, two border, but on the medial end, as it is rounded, it has total four surfaces. So first I will say about the medial part. In the medial part, four surfaces, each have some information. Anteriorly, in the medial two-third, there will be origin of one muscles, name of that is called pectoralis major. In the superior surface, close to the medial end, there will be origin of sternocleidomastoid. Posterior surface of the medial end of the clavicle is related with two structures. What are the two structures? Trunk of the brachial plexus and third part of axillary artery. When we see inferior surface contain a groove and name of this groove is called subclavius groove. This subclavius groove contains subclavius muscles and lip of this subclavius groove contain clavipectoral fascia. Just close to the medial end, here there will be attachment of the capsular ligament of sternoclavicular joint. Other than this capsular ligament, there will be also attachments of interclavicular ligament, costoclavicular ligament. Come for the lateral end. Lateral end, already I said, it possesses of two surface and two borders. Anterior border, here will be attachment of deltoid. And posterior border, here will be attachment of trapezius. Even superior surface also close to the anterior border will be related with the origin of deltoid. And posterior border is sharply related with the insertion of trapezius. If we see the inferior surface of the lateral one-third, there is a tubercle, we are saying it is called conoid tubercle. And there is a roughened area, we are saying it is called trapezoid ridge. In the conoid tubercle, there will be the conoid part. In the trapezoid ridge, there will be the trapezoid part of the coracoclavicular ligament attachment. Now we are going to discuss about the ossification related with these bones. As we know, it is a modified long bones. Its shaft developed from primary ossification center and two end developed from secondary ossification center. In shaft, there will be two primary ossification center which appear by the age of 5th to 6th week of intrauterine life. That means before birth. And these two end having secondary ossification center which appear after birth. In case of medial end, it will be appear at the age of 20 years. in case of lateral end, it will be also appear from the age 19 to 20th year. With the shaft, this both end fusion also we are asking. In case of medial end, with the shaft, it will be united at the age of 25 years. And in case of lateral end, when it appear, that means from 19 to 20 years it appear, and at that time it will be unite with the shaft. That means the growing end of these bones will be the medial end, because it appear first and unite with the shaft at last. Now, in this part, we are going to discuss about clinical anatomy related with these bones. So, common fractures in these bones site we are asking. So, commonest site of fracture will be the junction between the medial 2/3 and lateral 1/3. And when there is fractures, the medial portions will be directed upwards because of the pulling action of sternocleidomastoid. And the lateral 1/3 half will be pulled down because of the weight of upper limb. There are two more clinical conditions. One is clavicular dysostosis, where the two primary ossification center wise development will be in the both side, and in the middle they will be failed to fuse. So a single clavicle will be two pieces. This condition we are saying it is called clavicular dysostosis. Another terms related with these bones is cleidocranial dysostosis. Congenitally absence of the clavicular bones, we are saying it is called cleidocranial dysostosis.